right, millions of Americans suffer from back pain, including yours truly. Now, if you have lower back pain, you've probably been told that in order to get better, you have to strengthen your core. But if you choose the wrong exercises, you could end up making your pain worse. Joining us this morning is Julie Moon, owner of Moon Physical Therapy.
Hi.
Julie, thank you so much for joining us because this is a hot topic for yours truly, lower back pain. What are the causes of some of the lower back pain issues?
Well, back pain can affect any age. I'm treating somebody that's 7 years old, and I've treated all the way up to 101. So it can be caused by a bunch of different things. You can have sprained strains, disc problems from bending over, picking up something up wrong, repetitive lifting, carrying, if you're weak around this area. You can have degeneration from aging or chronic poor posture, sitting at a desk that's ergonomically incorrect. That can cause back pain.
So you're basically calling me old.
All
right, so you talk about strengthening the core, midsection. What are some of the important factors to know about that?
So, before you kind of choose an exercise for your back, you want to make sure that it benefits your condition because there's so many things that can go on with your back. Make sure that if you have like a disc problem, you're not doing a bunch of sit-ups or curl-ups because that's just pushing the disc out further. You're going to make things worse. And then the last thing that you want to you want to make sure is you strengthen your TA muscle, which is your transverse abdominis.
Okay.
This muscle, I feel, it's the most important muscle in your abs. It's pretty much overlooked a lot of times, and because of where it's attached, it attaches on your spine and it wraps around your waist.
Okay.
It essentially works to stabilize your spine. It can reduce back pain if you're strong, and it slims your waist.
Okay, so what are some of the exercises that you want to show us today in terms of strengthening your core?
So I got two, and they're both safe for all forms of back pain.
Okay, so
you're going to lie in your back.
Assume the position.
Yep. So you want to make sure that your back is in a comfortable position. So you're not really pushing your belly down yet. You're not arching. Find your neutral spine, which is right in the middle. So you want to be like this or like this? Yeah, so it should be right in the middle, comfortable. Okay. And then you're going to find, with your fingertips, you're going to find that bony area that's on your pelvis. Okay. You feel that? Yeah. So that's your ASIS. You're actually going to take your fingertips and go about an inch inward, and then an inch down. Okay. So if you have difficulty feeling it, all you want to do is cough. And then do you feel the muscles kind of pop up?
Contracted.
Yeah. Okay, so the exercise is you're just relaxing your head. Okay. You're pulling your belly and your lower abdominals in towards your spine. Now, you got to watch that you're not doing a crunch. Because that's going to facilitate more up here than down at your TA.
So your knees need to be bent?
Bent.
Straight? No, bent?
Bent.
And then you just...
And then you relax your head. It's a real small contraction. And you're holding that, for about 10 seconds. You're
basically kind of like bracing for someone to punch you in the gut?
Yeah, yeah. So, and just make sure you're breathing normally throughout the exercise. You can do 2 to 3 times a day. The more you do this, the better, actually. And you can practice sitting, standing, and I challenge anybody to do it throughout the day.
Okay, so that's one exercise you can do at home.
Okay, and then the next one is you're staying on your back. Okay. Your legs are bent. We're going to be doing a reverse plank. So you've all heard of normal planks. I think the reverse plank is the harder one to do. Okay. And it's great because you're strengthening the postural muscles all along your backside plus your core. Okay. So your knees are bent, your legs are straight, straight out. Feet together. So legs straight, feet together. And then arms are externally rotated out, so your palms, so keep them down here by your side. And then put your palms up. There you go. Squeezing your shoulders back. So you're kind of pinching your shoulder blades. Okay. And then feet and legs together. And then with your core muscles tight, you're going to lift your body up, pushing. Yep.
Does it even look like I'm lifting?
Yeah. And so just tighten up your tummy. And you're going to hold that for about 10 seconds. You can, just like regular planks, you can work on 30 seconds.
Are your hamstrings supposed to be pretty active?
So you're strengthening your glutes, which is important for the back too, hamstrings, all the postural muscles, plus the core, which is really important.
So you need to hold it for like 10 seconds?
Yep, you can work up to 30.
Breathing.
Yep, and if this is hard, you don't really have to lift your body up. You can start by...
You're shaking?
Yeah. How's that?
That's the very hamstring activated, so obviously you need to see Julie so you can actually get it correctly done.
Yes.
Sometimes you overcompensate, and that way you can tell.
Yeah, ask a PT.
All right, there you have it. Julie Moon from Moon Physical Therapy. Thank you so much for joining us. We'll have much more when we come back from Take Two.